Hello and good morning, everybody. Welcome to this exciting session on visual analysis and health. It's going to be a short session since we have only one talk, but nevertheless a very exciting session. And this talk is given by Professor Bernhard Preim from the University of Magdeburg, and together with Kai Lavon, he wrote a survey of visual analytics in public health, which was a regular survey for CGF. And I'm very much looking forward to this very interesting talk. And without further ado, I leave the stage to Bernhard and the presentation.
Yeah, welcome to my talk, a survey of visual analytics in public health, joint work with Kai Lavon from University of Jena. You see here at the title page an image from the Malaria Atlas project that shows already that public health data is often spatial data. It's also often spatiotemporal data. Let me start by describing visual care. Visual analytics is extensively used for clinical decision making in the hospital, for rehabilitation purposes, and also for personal health, where you manage your health data yourself. Public health, in contrast to clinical decision making, is more about preventive medicine, and that is the focus of this talk. There is a workshop series from the IEEE, Visual Analytics in Healthcare. There the focus is more on clinical decision making, so we found very few papers discussing public health. What is public health? It is the science and art of preventing diseases and prolonging life, promoting human health through activities and efforts informed choices of society. That's the classic definition of Amory, which is already 100 years old, but still considered as valid. Who are the users, the stakeholders in public health? There are epidemiology practitioners. These are people working in health offices, which we have at various levels, local, regional, national, and international. They deal with the outbreak of salmonella, with malaria, also with influenza outbreaks. Sometimes they have to deal with topics quite urgently. And then there are academic epidemiologists working in research institutes and universities. So typically these are scientists, and their major activity is to prepare something that they can publish scientifically. They are interested in studying long-term effects of health risks, risk factors that contribute to the outbreak of chronic diseases and severe situations of chronic diseases. Some other specialists are also important. So, for example, specialists for environmental health can help with their knowledge about the influence of air and water quality on human health. And veterinarians also are essential, since humans and animals. Yeah, what are the results of public health activities? So, for example, screening programs were introduced, breast cancer screening, for example, where the goal is to detect diseases or health risks as an early stage where they can be treated quite efficiently. Also, vaccination programs have been established based on the research of epidemiologists with respect to cost effectiveness, for example. There are information campaigns. Yeah, when AIDS came around, many information campaigns were started in order to control the spread of the disease. And as we have all seen in the last weeks and months, public health authorities can other measures that affect public life quite considerably. Epidemiology research investigates health-related events in defined populations. A defined population could be the population from a certain area or in a certain age group. They are interested in the incidence and prevalence of diseases, that is, the frequency of diseases. They are also interested in comorbidities. That means the identification of disease networks. If people have one disease, perhaps early in life, which other diseases may occur later on, and of course they want to understand how to avoid this. So therefore they are interested in factors that contribute to the outbreak of diseases, which include avoidable and non-avoidable factors, and a focus is often on the avoidable risk factors. Yeah, let me briefly describe our survey process. We searched in the digital libraries from Eurographics, ACM, IEEE, and Google Scholar using keywords such as pandemics, epidemics, public health, and prevention. And in the medical library PubMed, we searched for visual analytics. We had to condense a lot and remove many hits of this search, and at the end we included in our survey 20 publications from EG&A, many more computer science publications, and also a lot of medical publications. The journals that occurred most are the Journal of American Medical Informatics Association, the Online Journal of Public Health Informatics, Biomedical Informatics, and the International Journal of Environmental Research and Public Health. I want to start with commenting on visualizations and analytic techniques that are used frequently in public health. I have seen several examples of age pyramid-based views. I will show an example in a second. Many map-based views, as already in the title page. Cohort maps that are based on administrative units. Dot plots, where, for example, hospitals are shown on a map, so that's more discrete. Heat maps is more continuous, showing the distribution of diseases, for example. And with respect to the temporal character, an epidemic develops over time. I have seen many examples of parallel coordinates. And with respect to analytics techniques, there is regression modeling, spatial statistics, and we have seen all types of clustering. So here's an example for an age pyramid-based view. So the age pyramid indicates frequent diseases for different age groups. You always have males on the one part, females on the other part, and you have here the different ages, in this case ranging from 65 to 85, and this disease occurs more frequently in elderly persons. Yeah, what are the activities in public health? A lot deals with monitoring, surveillance, and outbreak detection that comprises not only infectious diseases but also foodborne diseases or waterborne diseases, in particular in tropical countries. So that's the area for epidemiology practitioners. Long-term epidemiology research is related to chronic diseases. It's also to drug-drug interaction, the long-term effects of drugs, and also about injuries. If a certain type of injury occurs more frequently, epidemiology research tries to understand the reasons. Yeah, let me describe outbreak detection a bit more. It is about collecting data on reportable diseases in a quite standardized way, and people look there for abnormalities, abnormalities compared to typical seasonal patterns, and in case abnormalities were found, then of course further data is analyzed to detect outbreaks and assess their severity. It is also typical that people simulate effects of different measures, so they can carry out what-if simulations. Yeah? What happens if we start contact tracing and quarantine for this particular disease? The data that is involved here, and I use also to hospital admission data, and as we have also seen from Corona, it's also interesting how many people have to be sent to the intensive care unit. The sales of drugs may also add valuable information, and mass media are analyzed for further cases that may be not part in the registries already. So this data is multi-source. It's also multi-scale, in particular on the spatial. The spatial character is multi-scale. And the data has quality problems, of course. Yeah, it is notoriously incomplete. It is delayed, so the moment when people get infected is not the moment when we have a confirmed case in a registry. Yeah, several time spans occur in between. So overall, the data is uncertain. And maybe the difference between the reported cases and the actual cases is the most important source of uncertainty. Yeah. So we often see spatiotemporal visualizations like this dashboard here from Johns Hopkins University with respect to corona. It shows a map, the distribution of the cases. There are temporal curves, could be also shown on a logarithmic scale, or the daily cases, different types of information that is used for communicating with the public, but also for communicating inside public health authorities. Yeah, a few more comments on long-term epidemiology research. Epidemiological instruments there include randomized controlled studies, that would be prospective, meta-studies where results are pooled and combined from different studies, and particularly important are cross-sectional studies and cohort studies where participants are randomly selected from a defined population that occurs either for one point in time or to study long-term effects over longer periods, often for decades. Yeah? These studies serve to better understand normal aging on the one hand and frequent diseases. You cannot study a rare disease if you invite random people, because then you would have to invite many millions to have enough occurrences of rare diseases. So it's focused on diseases such as diabetes. Yeah, what is part of these cohort studies? There are questionnaires, there are various examinations, there are laboratory tests, and increasingly there are image data such as ultrasound and magnetic resonance image data. Here are some examples of large cohort studies. I think the Rotterdam study is pioneering here. It was focused on elderly persons, so they were over 55 already in the beginning. And yeah, it's amazing that more than 1,000 medical journal publications resulted from this study. In Germany, we have the Study of Health in Pomerania that started in 1997. There is the UK Biobank that involves also genetic information, and the national cohort in Germany started 6 years before. Things. Yeah, in the remaining part, I want to very briefly introduce some key publications as I would consider them based on representativeness and impact. There are two papers first authored by Ross Maciejewski. There is a further paper from the same group where David Ebert was the supervisor. There is work on visual analytics related to air quality problems, air pollution. So it turns out that many attempts have been made to better understand the influence of air pollution. And there are finally two papers related to cohort study data. Yeah, let me start with this paper from Ross Maciejewski, Lahva, Linked Animal-Human Health Visual Analytics. You see a map here that shows hospitals in their spatial distribution, veterinary hospitals and human hospitals. As a tooltip, you get information about the number of infected cases treated here. Individual cases are also shown on the map. And you see also the temporal course of influenza within dogs and humans. So it's hard to recognize, but there are two curves that show this temporal pattern of dog and human influenza. Yeah, and the consequence was that there is indeed a correlation. Often dogs get influenza earlier than the humans that care for them. Yeah, later work from Ross, a visual analytics approach to understanding spatiotemporal hotspots. Various data is collected and a lot of data management has to be carried out. data cleansing and transformation, and then we have a curated database. And from an algorithmic point of view, two things are interesting. On the one hand, geospatial modeling, and on the other hand, time series modeling. Yeah? And that is used in order to generate interpretable and reliable visualizations of these data. So here you see a continuous heat map, for example, that was created with kernel density estimation. So the discrete occurrences of diseases are transformed to a continuous representation. Presents a training system for pandemic visualization, visual analytics decision support for epidemic modeling and response evaluation. So here the goal is to increase situational awareness and preparedness for an outbreak of a pandemic. It's based on historical data like the Spanish flu. This information is available and various simulations can be carried out. Various information is shown, so for example how many vaccines are still available over time, and an essential part is this temporal visualization which you see here. So these are the days after the outbreak. It's 1 year what is simulated here, and certain measures can be carried out, like quarantine and contact tracing is started here, and the question is how many lives are saved or lost depending on these different measures. So you can compare here different ways how to respond to this outbreak. Another important research relates to air pollution, and not surprisingly that was motivated primarily by the strong air pollution in some Asian cities. Haimon Q's papers relates to the situation in Hong Kong. Yeah? It's clear that air pollution causes substantial health problems, which is due to man-made effects like traffic and industry, but also is strongly related to weather conditions. Yeah? It involves influences on different scales, and of course it's not restricted to some Asian cities. Yeah? To assess causal effects and influence health policy is important here. So here is a screenshot from his work. They collected data on various pollutants, yeah, you see them here, and also various weather attributes. They came up with parallel coordinate views in order to visually reveal correlations between pollutants and weather attributes, and in case of strong correlation, they draw an edge here in this graph. So for example, temperature, high temperature, and high amount of solar energy affects ozone. Yeah, that would be one example of this work. Later there was a lot of follow-up work, but I want to emphasize this paper on spatial clusters of air quality from Zhu. You see here a map with different stations where air quality was measured, related to different pollutants. Here you see the temporal course for these 3 selected stations over 1 day. Yeah? So these are the 24 hours of the day. Here's a summary of the temporal development for the 24 hours of the day, for the 7 days of the week, 31 days of a month, and for the different months. So that of course is aggregated information, average information from these other temporal scales. Yeah, so that's quite essential work. Let me briefly discuss work carried out in our group. We analyzed cohort study data and tried to integrate information derived from MR images with sociodemographic features such as body mass index, or whether or not people had headaches or back pain in the last month. What you see here is a result from clustering the spines after image analysis. So people have different spine shapes, and that was combined in a user interface with information on patient age, whether or not they had back pain. So here you see these different shapes of the spine. You see people that are very small, have an average size, or are quite large, so they have different shapes of the spine. And some of them had back pain, that is the lower part of this diagram, and others have not. So these kinds of relations we could investigate with this was a convenient drag and drop interface. Later, we looked in regression analysis and came up with 2D and 3D visualizations, regression between different attributes. That was a zoomable user interface, so you could look here in more detail, and color indicates whether there are strong positive or negative correlations. That was restricted to linear correlations. Of course, others could also be interesting. Yeah, let me summarize the talk. Public health benefits from a tight integration of data analysis and visualization. Visualization, as I found particular in the medical papers, is particularly used and useful for communication. Yeah, that is what they use it for. Surveillance and outbreak detection employs spatiotemporal data, so therefore we have seen a number of map-based use and timeline-based use. What I could not show here for the sake of time is that there is also a lot of visual analytics related research to derive subpopulations that are particularly vulnerable to certain diseases. Cohort construction, subspace clustering, and association rule minings are methods that are used along with appropriate visualizations to identify these subpopulations. I showed that linear and nonlinear regression is essential for identifying risk factors, and visual analytics is also used for quality assessment. So work I could not present here relates to missingness in data, missingness over time, dropouts, and imputation strategies in order to treat for these missing data. Yeah, I want to thank Kai, my co-author, as well as the whole team that worked on the cohort study data, including the epidemiologists Katrin, Till, and Henry. And with this, I'm at the end of your talk. Thanks for your attention.
Yeah, thank you, Bernard. Thank you very much for this great talk on a very timely topic. I guess you probably yourself did not know how timely it would be when you created this survey. So while I'm waiting for questions from the audience, let me just start with one question myself. Is there anything you would have done differently in this survey if you had written it during this current COVID-19 pandemic?
Yeah, can you hear me?
Yes, I can hear you well, at least.
Yeah. Yeah. Of course, I would use more examples from the Corona situation. It would be quite interesting examples if I think of the pandemic visualization system, for example, that is fed with data from the Spanish flu in particular. And of course, the current situation would provide a lot of data where one could learn a lot about different countries have responded in different ways, and one can analyze the effects that this actually has. I think in the future, this will help a lot in order to make better predictions, which interventions are more or less effective.
Okay. So thanks for this answer. And in the meantime, there's one question from Noska, and the question she is asking relates to translating medical visualizations to clinical practice. So Noska is saying that I'm aware of certification limiting translation of medical visualization techniques to clinical practice. How is this situation for public health visualization solutions? Is it an easier process there to get uptake by the users?
No, it is not an easier process, and I want to be very honest. The whole development that we did since 2012 with the partners in Greifswald led to nice web-based tools developed primarily by Paul Klemm and later by Shiva, but they are not used in practice. In practice, they use primarily R, and they use statistical facilities. So that is still difficult also there. I would suppose that two things are important to improve this. On the one hand is to develop systems that provide really substantial forms of guidance. There is a knowledge gap between what the users are aware of and what the systems provide, and guidance may help to resolve this. And the second strategy could be pair analytics or cooperative analytics, so that the analyst really sits together there with the visual analytics experts, and they share their knowledge and add each other with their capabilities. That may be promising. What I have seen in the public health journals, I really like this journal of public health informatics. That was something I was not aware of before. They reported on many instances where visualization was used for the communication, in particular also for the communication with the politicians when it comes about discussing specific measures that could be taken.
Yeah, communication with politicians, I think very interesting topic, although not all of them listen to what scientists communicate to them. But so let me check the channels if we have further questions. By the way, Bernhard, you received many clapping and also some washing hands.
Oh, great! Thanks a lot.
We are very, very happy with your great talk. Then maybe I can ask another question. So what often comes to my mind is that a lot of works and papers, they start with perfect data. So they start right away with the data analysis, and the data preparation is discussed either only briefly or completely neglected. And you mentioned also already the problem of missing data evaluation and data imputation. You have done a lot of work on this. So I was wondering, how important are these measures actually in public health routine? So are epidemiologists, for instance, are they using this missing data evaluation and data imputation?
What they do a lot, according to the papers that I've read from their side, is they discuss data quality really a lot. That is really important for them. They are always aware that data that is in registries is only about the reported cases, and the actual cases is much larger. So they make a lot of checking in order to compare, is there something that makes the data suspicious? So one example from our cooperation partners, they analyze blood samples in 2 different labs because not a single lab has enough capacity to do so. Every week they compare the measurements for any abnormalities to find out whether there could be a systematic bias between the blood samples in the 2 different labs. And with respect to the MR data, they use one MR scanner for the whole 5-year period. No protocol is allowed to be changed, no sequence is allowed to be changed, and they make a lot of quality checks that the signal still remains basically the same, so that they can rely as good as possible on the data. And what they really want to have is a good overview about the amount of missingness. Also to see some relations between, if this data is missing, then with a higher likelihood another set of data is also missing. So they are interested in this. That they really use multiple imputation in practice, I'm not sure about. I have not read this.
Okay. Thanks, Bernhard. I just got distracted by another question. So thanks for this question on the Discord channel. It's a question by Ilya, and it's related to the answer you gave to Noskav's question. So I'm reading the question. So should education in context of visualization literacy among practitioners in the domain be the key for improving the uptake, or perhaps working with them to create standardized visualization and interaction techniques for specific purposes?
I think the latter is more promising, trying to avoid that we provide a zoo of different visualization and analytics techniques and strategies, how to synchronize and coordinate. If we would come up with a more standardized way of doing things that could be helpful. Computer graphics, they have OpenGL, so that's basically the standard for many things. We don't have such thing in visual analytics, and that could be helpful. That we can force another profession to do a certain type of education, I think that is not promising. We as computer scientists would be reluctant if from outside we get explained which type of education we should follow. That would have acceptance problems.
Yeah. That's true, but on the other hand, I know that you have been working on education of medical students, for instance. So
yeah.
you try from time to time, at least.
Yeah, but not to explain them something from our side, but better to help them to learn, what they know with classical methods in surgery or anatomy, for example.
Yeah. Okay, so there's another question coming from the audience, and this time Laura Garrison is asking. And Laura wants to know, she's got first that most of the applications we have seen so far involved multiple views, optimized then for larger screens or desktops. So how do you think, Bernard, we could adapt some of these approaches for smartphones, for instance, for clinicians to use on the go?
It is a good question, and I have not a really good answer for this. Thinking back to what I have read, at least there are at least very, very few attempts, if at all, to do so. So typically these people are not somewhere in the field where they have to rely on their smartphones. They are in rooms where they have a desktop situation, an office situation, and they can even use quite large displays. So it would be a nice academic exercise to try to bring things on the smartphone. For example, I have tried to look at the corona map from Johns Hopkins at the smartphone. Yeah, that is possible, but indeed quite difficult. Yeah, you have a number of confusing situations with the interaction because you only see such a small part of the overall visualization. I think this whole idea of providing a dashboard, which basically means that the important information is shown at one glance, that unfortunately does not scale to smartphones.
Okay, so let me check whether there are more questions. If not, I have another one. So what I really enjoy about surveys is if they are not only describing the work that exists, but if they also show where are gaps and what are we missing. And most of them do, and you do as well, and you do a very great job in this, and you have identified some topics for a future research agenda. And one of these topics is moving from association analysis to causality analysis. Can you elaborate a bit more on this? And do you have any ideas how this could be achieved?
Yeah, first I want to comment how I came to this statement. We found in all the discussions with our partners that what they are actually interested in are causalities. And they always are suspicious if they see correlations, even strong correlations and associations. There could be a confounder, it could be not the true relation. So that was one reason to think about this. Without having analyzed this, I saw that there are quite a lot of papers meanwhile that deal with causality. In our community, I'm aware of some work of Klaus Müller in image analysis, data analysis. There is primarily Bernhard Schölkopf's group in Tübingen that deals a lot with causality. So they try to help analysts to create what they call causality graphs, quite small representations with edges that really have a causal relation. So I think it would be worth to look more carefully than I did in this area of causality analysis and causality visualization and try to link this. We really have no own work in this area.
Yeah, and if I can also comment on my own question, we are in contact with a causality analyst, and they usually they start with very small models. So we try to convince them by a large causality graph that we learned from the data, but that was a completely new way of thinking for them. So they are usually working with very small causality models, first two variables, and if they have a very good day, they include a third one, and then they investigate the causality. But they said that maybe the work that we are doing can point them to interesting causalities that they would like to investigate further then. Okay, there's no more question from the audience, but we have plenty of time, so I dare to ask a final question from my side. From my own work, I know that most visualization techniques that are integrated and in these visual analytics tools that you also presented, they focus very much on numerical data. So the statistics that are used were made for numerical data, but in the data you usually have a mix of numerical and categorical data. Did you investigate this also in the survey? And are there specific techniques that you would recommend if you have a mix of data?
Yes, that's a really important question. We have all types of different data, starting from binary data, where yes, no question is answered, to data with a very low range, only a few values, up to the full range of numerical values. I found that often clustering is used to better understand the data, and there are techniques or distance measures that really have a heterogeneous distance measure. That is, they consider the overlap in categorical data with a certain weighting factor that needs to be carefully chosen. And the numeric data for this, they compute the Euclidean distance and combine this as a measure for clustering. We saw often mosaic plots, histograms. Mosaic plots are for categorical data, for quite small data, but of course also scatter plots for the scalar data. So often it is a mixture of different visualizations for the categorical data and for the scalar data. Yeah, whether there is still a demand for future techniques that better integrate this, I'm not sure actually.
Okay, thanks Bernhard. Thanks for your answers. So I don't see any further questions, neither in the YouTube channel nor in the Discord channel. So since we had an odd number of stars, there had to be one session with just one talk, and this was this session. So this session is a bit shorter than you would expect it to be. Yep. But I very much thank the audience for their questions, their comments, and I very much thank you, Bernhard, again for this excellent talk, and also Kai, of course. And this closes the session. Thank you very much.
Thank you very much. It was nice to see you virtually.